Vitamin B12 is essential for the proper functioning of the body, playing a crucial role in the metabolism of proteins, fats, and carbohydrates, as well as in the production of red blood cells and in maintaining the health of the nervous system. However, a deficiency of vitamin B12 may be related to various health problems, including depression. This video will explore the relationship between vitamin B12 and depression, highlighting the importance of understanding this connection and its implications for overall well-being. Following the details of the video, vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a fundamental role in mental health. It acts as a cofactor in several enzymatic reactions crucial for brain function, such as neurotransmitter synthesis and nerve myelination. A deficiency of this vitamin can result in mood changes, concentration difficulties, and even the development of depressive disorders. Therefore, it is essential to follow the details presented in the video, as they provide valuable information on how vitamin B12 can influence mental health and the importance of maintaining adequate levels of this vitamin. The video will address the most common causes of vitamin B12 deficiency, such as vegetarian or vegan diets, intestinal absorption problems, certain medical conditions, and prolonged use of some medications. This information is crucial as it allows viewers to identify potential risk factors and adopt preventive measures if necessary. Understanding the causes of deficiency is the first step in preventing and treating health problems related to it. Additionally, the video will also examine symptoms associated with vitamin B12 deficiency, including fatigue, weakness, paresthesia, tingling sensation, memory problems, and, of course, depression. Knowing these signs and symptoms is essential so that viewers can early recognize possible health problems related to vitamin B12 and seek appropriate medical attention. The explanation of the biochemical mechanisms linking vitamin B12 to depression will be especially important. The video will likely address how deficiency of this vitamin can affect neurotransmitter production, the integrity of the myelin sheath, and the overall functioning of the central nervous system, contributing to the development of mood disorders. Understanding these biological processes will help viewers better understand the relationship between vitamin B12 and mental health. Furthermore, the video will likely discuss treatment and prevention approaches for vitamin B12 deficiency and its relationship with depression. This may include recommendations on food sources rich in this vitamin, supplementation when necessary, and guidance on laboratory tests to assess vitamin B12 levels. This information is essential so that viewers can take proactive measures to maintain their health. Finally, the video may present success stories or reports from individuals who have been able to improve their depressive symptoms after correcting a vitamin B12 deficiency. These testimonials will help reinforce the importance of this connection and inspire viewers to seek proper medical and nutritional support. In summary, closely following the details presented in this video about the relationship between vitamin B12 and depression is essential, as it provides valuable information on how this essential vitamin can impact mental health. By better understanding this connection, viewers can take preventive and treatment measures, contributing to a significant improvement in their overall well-being. The relationship between vitamin B12 and depression has been the subject of investigation and debate in academic and medical settings. Vitamin B12 deficiency may be related to depressive symptoms, and treatment with vitamin B12 supplements may be beneficial for people with depression. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays an important role in cell metabolism, red blood cell formation, and nervous system maintenance. Vitamin B12 deficiency can cause pernicious anemia, neuropathy, mental confusion, depression, and other symptoms. Vitamin B12 deficiency can be caused by various factors, including a diet deficient in foods rich in vitamin B12, such as meat, fish, eggs, and dairy products, the body's inability to absorb vitamin B12 due to digestive tract problems such as Crohn's disease or stomach resection, and the use of medications that interfere with the absorption of vitamin B12, such as gastric acidity-reducing medications. Depression is a common mental illness that affects a person's ability to feel pleasure, interest, and motivation. Depression can be caused by a combination of genetic, environmental, and psychological factors, and can be treated with therapy, medication, and a healthy lifestyle. Recent studies have suggested that vitamin B12 deficiency may be related to a higher incidence of depression. A systematic review of 16 studies with a total of 3,968 participants found that vitamin B12 deficiency was associated with a higher risk of depression. Additionally, a prospective cohort study with 90,211 women found that women with vitamin B12 deficiency had a higher risk of developing depression than women with adequate levels of vitamin B12. Despite these findings, the relationship between vitamin B12 deficiency and depression is still not fully understood. Some studies have suggested that vitamin B12 deficiency may affect brain metabolism and neuronal function, which may contribute to depressive symptoms. Other studies have suggested that vitamin B12 deficiency may be associated with changes in the production of neurotransmitters such as serotonin and dopamine, which play an important role in mood and behavior regulation. Treatment with vitamin B12 supplements may be beneficial for people with depression and vitamin B12 deficiency. A randomized clinical trial with 164 participants found that treatment with vitamin B12 supplements reduced depressive symptoms in people with vitamin B12 deficiency and depression. Additionally, a prospective cohort study with 97,709 participants found that the use of vitamin B12 supplements was associated with a lower risk of developing depression in people with vitamin B12 deficiency. In addition to vitamin B12 supplements, other treatment strategies for depression include therapy, physical exercise, healthy diet, and stress reduction. Therapy can help individuals identify and change negative thoughts and behaviors, while physical exercise can help reduce inflammation and improve mood. A healthy diet rich in fruits, vegetables, lean proteins, and whole grains can help reduce inflammation and improve mood, while stress reduction can help decrease the production of stress hormones that can affect mood and behavior. Vitamin B12, also known as cobalamin, plays a fundamental role in mental health, and its role in depression has been widely studied. This water-soluble vitamin is essential for various physiological functions, including red blood cell production, maintenance of the myelin sheath covering nerves, and neurotransmitter synthesis. A deficiency of vitamin B12 can lead to a range of neurological and psychiatric symptoms, including mood changes, concentration difficulties, irritability, and eventually, the development of depressive disorders. This occurs because vitamin B12 is involved in crucial biochemical processes for the proper functioning of the central nervous system. One of the main mechanisms by which vitamin B12 deficiency may contribute to depression is its influence on neurotransmitter synthesis, such as serotonin, dopamine, and norepinephrine. These neurotransmitters play a fundamental role in regulating mood, motivation, and cognition. When vitamin B12 levels are low, the production of these neurotransmitters may be impaired, leading to changes in mood and emotional well-being. Additionally, vitamin B12 is also essential for maintaining the integrity of the myelin sheath, which covers neurons and facilitates the transmission of nerve impulses. A deficiency of this vitamin can lead to damage to the myelin sheath, impairing communication between different areas of the brain. This neural disconnection may contribute to the development of depressive symptoms, such as concentration difficulties, lethargy, and mood changes. Another mechanism by which vitamin B12 deficiency may be related to depression involves homocysteine, an amino acid associated with a higher risk of cardiovascular diseases and neuropsychiatric disorders. Vitamin B12 acts as a cofactor in enzymatic reactions that regulate homocysteine levels in the body. When there is a deficiency of B12, homocysteine levels tend to rise, which can negatively affect brain function and contribute to the onset of depression. It is important to note that vitamin B12 deficiency can have various causes, including vegetarian or vegan diets, intestinal absorption problems, certain medical conditions, such as Crohn's disease and pernicious anemia, and prolonged use of some medications, such as proton pump inhibitors and metformin. Therefore, it is essential to identify and treat the underlying cause of the deficiency to achieve the best results in managing depression related to this nutritional deficiency. Symptoms associated with vitamin B12 deficiency may include fatigue, weakness, paresthesia, tingling sensation, memory problems, mental confusion, and, of course, mood changes such as depression and anxiety. It is important for individuals to be aware of these signs and seek laboratory evaluation to check their vitamin B12 levels if they experience any of these symptoms. The treatment of vitamin B12 deficiency and its relationship with depression may involve various approaches. In cases of deficiency, oral or parenteral supplementation of this vitamin may be necessary to normalize levels and improve neuropsychiatric symptoms. Additionally, adopting a balanced diet with foods rich in vitamin B12, such as meats, dairy products, eggs, and some vegetables, may help prevent and treat deficiency. Studies have shown that correcting vitamin B12 deficiency can lead to significant improvements in depressive symptoms, with a reduction in severity of episodes and improvement in mood and quality of life of patients. This underscores the importance of a comprehensive assessment of vitamin B12 deficiency in individuals with mood disorders, in order to identify and treat this possible underlying cause. Furthermore, some successful cases have been reported where vitamin B12 supplementation led to a notable improvement in depressive symptoms, often more quickly and effectively than the use of conventional antidepressants. These reports reinforce the relevance of vitamin B12 as an important factor to be considered in depression management. It is important to emphasize that the relationship between vitamin B12 and depression is not limited only to deficiency of this vitamin. Some studies have also investigated the role of B12 supplementation in individuals with depression, even without proven deficiency. The results suggest that supplementation may have beneficial effects on depressive symptoms, possibly through the modulation of biochemical and neurological processes related to mental health. Therefore, assessing vitamin B12 levels should be a fundamental step in the investigation and management of patients with mood disorders, including depression. This approach allows the identification of possible underlying deficiencies and directs treatment more effectively, contributing to a significant improvement in the overall well-being of these individuals. In conclusion, the relationship between vitamin B12 and depression is a topic of great relevance in mental health. Deficiency of this vitamin can lead to neurological and biochemical changes that contribute to the development of depressive symptoms. Recognizing this connection and adopting appropriate preventive and treatment measures can play a crucial role in improving mental health and overall well-being of affected individuals. The relationship between vitamin B12 and depression has been a topic of interest in recent years. Research suggests that a vitamin B12 deficiency may be related to an increased risk of depression. This is because vitamin B12 plays a crucial role in the functioning of the brain and nervous system, and a deficiency can lead to neurological symptoms that are also associated with depression. If you're feeling tired, weak, or experiencing symptoms of anemia, it's important to check your vitamin B12 levels. Foods rich in vitamin B12 include fish, meat, poultry, eggs, and dairy products. If you follow a vegetarian or vegan diet, you may need to take vitamin B12 supplements to ensure you're getting enough. While vitamin B12 supplements are generally safe, it's important to consult a healthcare professional before starting any new supplement regimen. They can help determine the appropriate dose and frequency for your individual needs. If you found this information helpful, consider liking and subscribing to our channel for more health and wellness content. Your engagement with our channel helps us continue to provide valuable information to our audience.